Foundation, Jiva Ayurveda, Meiteon Therapeutics. Welcome to Modern Medicine and Ayurvedic Perspectives on COVID-19. We are honored to be able to hear from the luminaries in the fields of Ayurveda and allopathic medicine who will inform us about the current status of COVID-19 in India and the new approaches Please include your location and the speaker to whom your question is addressed. What I would like to do is, I would like to do a short prayer to bridge humanity. Brothers and sisters in India and around the globe, we are suffering this great tragedy. So allow yourselves to be present center. Take a nice deep breath. Om Sarve Bhavantu Sukhina, Sarve Santu
Niramaya,
Sarve Bhadrani Pashyantu, Ma Pashyantu Bhavave. Hari Om, Shanti, Shanti. May every entire humanity be happy and free from diseases. May we all see goodness in everything that we see. And may we wish upon health and happiness and peace and joy to everyone. Namaste, and thank you for joining us today. And it's my great honor and privilege to introduce Dr. K.K. Agarwal. He's a luminary, often called as the doctor for Indian people, is a cardiologist, president of the Confederation of Medical Associations of Asia and Oceania, which is entire Southeast Asia. He was the past president of Indian Medical Association, and he's the president of the Heart Care Foundation, where his tireless work and pursuit continues. And the post-national president of the Indian Medical Association, but more importantly, he was awarded Padma Shri for his services and contributions in the field of medicine. He has published many books, textbook chapters, and has thousands of articles in national and international press. He's a recipient of numerous awards, and we are so happy to have him speak at our symposium today. So without further ado, Dr. K.K. Agarwal.
Thank you, Dr. Suhas. Thank you all of us here, Dr. Pratap, Dr. Pong, Dr. Paul, Dr. Bugal, Dr. Saran, Deepak, my everybody. Today, we are speaking at a time when India is showing a second wave. Its numbers are much more than were combined of US and of the Brazil. So I will start doing my slides. So the subject I am taking today is just go down. So the subject I am doing today is twist. What is happening is COVID management twist. How we started and how we are continuing. This is based on my experience of 2,278 and today, since morning, it is my 11th interaction with the people. And I reach around 7 million people every month and understand what is happening in the field of COVID and try to bring out answers in my mind. So we can see here, India, the number of cases are approximately 200,000, which they have. Actively, they are more than USA, Brazil, and France. The number of deaths, they are much lower than the Brazil. And if you can see the death per million population, 125 per million population is much lower than USA, Brazil, France, Russia, UK. If you see the top 10, India's mortality has been the lowest. Whatever may be the reason, somewhere the mortality reduction will go to our lifestyle, which we will talk. At this point in India, there are multiple COVID viruses which are spreading. We have primary 614 wild COVID. Then we have mutant COVID. We have UK mutant COVID, mutant South African COVID, mutant Brazil COVID. Then we have 448, 542, 452 double mutation Indian COVID, E gene target failure Indian COVID. Our reinfection rate is 4.5%, much higher than the West. And now moderate or severe pulmonary or systemic COVID. And well trained by Deepak. And long time back, I did a lot of work teaching and learning of modern system and Ayurveda. So let me see what is COVID. COVID is acute, so less than 3 months, manageable. We know the treatment today. Immunogenic, thrombogenic, inflammatory, contagious, novel, viral, disease. And we come back also to a Ayurvedic sutra. It is inflammatory, so it is a disorder. It has cytokines, so there is a pitta mala. That means we have a rasa rakta. Rakt mala is the pitta mala, which is equivalent to cytokines. It has systemic manifestation. In modern medicine, we say systemic inflammation. So in Alochak, we are seeing eye manifestation. In Bhrajak, we are seeing skin lesions. In Sadhak, we are seeing hepatitis. In Pachak, we are seeing small intestinal. And in Ranjak, we are seeing blood involvement. It is respiratory, so there has to be involvement of 5 prans, but it spares the Udan Vayu. Therefore, you have a happy hypoxia. So it is involving all other Vayu minus the Udan Vayu. It involves prana, happy hypoxia, vyana, small intestinal colic, vyana, tachycardia and bradycardia, apana, it producing constipation. It spares the kapha, it spares the shleshak joint, so there is no arthritis. There is no effusion in the joint. It spares the tarpak, so there is no hydrocephalus. It spares the bodhak, so there is no angioneurotic edema presenting. It spares the avalambak, so there is no pericardial effusion and no pleural effusion. It spares the cladec, so there is no GI manifestation related to the stomach, except for gastritis, which is pitta in origin. So therefore, this is a disorder primarily of Pitta. So it correlates with the modern medicine that this is a systemic inflammation. So there is a correlation between modern medicine and Ayurveda in terms of inflammation. It's a rasa rakta disorder. So there is an involvement of extracellular fluid and pitta mala. The treatment is anything which is bitter and astringent or anti-inflammatory pathways. So therefore, hydrochloroquine is bitter, colchicine is bitter. All allopathic modern medicines are either bitter or astringent. And the same thing came with Kada, the same thing came with Giloy, the same thing came with Kalmek. So we started a concept of bitter and astringent, Kadwa and Kasela as anti-inflammatory pathways. So there is a similarity between the two together. We all know here the involvement of virus. I'm not going to go into the details, but at this moment, I want to come back. India is showing twin pandemic, the pandemic of COVID and the pandemic of low-grade systemic inflammation. In Ayurvedic language, COVID is a disorder of an external disorder, and it also talks about low-grade systemic inflammation, which talks about a vitiated society. So at this moment, India is a pitta vitiated society. So they have excreted, they have a lot of mul present in the body. Therefore, two significant inflammation in the body, which ultimately leads to the production of clot. In Ayurvedic language, that is pitta vitiating the kapha and leading to the clot formation. In terms of inflammation, we have four different types of inflammations in the body. Free radicals, antioxidants. So here comes the role of Chyawanprash. And in our side, we have vitamin C, A, E, D. So there is a free radical injuries. Then there is a inflammation on the cell surface, which is happening with PLA2 and arachidonic acid pathways. Where comes the role of Montelukast? Where comes the role of other things? And then cell pathways. These are the predominantly responsible for pitta mala, which is they can be two pathways, Th1 and Th17. Th1 depletes lymphocytes and Th17 increases neutrophils. Up till now, we were thinking that COVID is a Th1 pathway, but of late now we have started about, once we have started seeing cases of autoimmunity exacerbating with the vaccine, now we know it has both Th1 and Th17 pathway. In Th1, there is a recruitment of lymphocytes and then depletion. In Th17, there are neutrophils which are recruited, and there comes the role of the TGF beta and IL6 and IL6. Both of them, they are responsible for the Th17 pathway. And then there is an internal pathway called TLR and NLR pathway. Where comes the role of Kalmake? Where comes the role of Kalmake and anyway, Kalonji, Kalmake, and there comes the role of colchicine. Again, all three of them are Ka, so they takes care of the TLR and NLR pathways. So free radical injury, I only want to say one word is Chyawanprash in Ayurveda is taking care of the free radical injury that comes as an antioxidant, as an immunity builder. In modern medicine, we are giving them vitamin A, C, E, and in Ayurveda, they give also equivalents to that. Now, coming back to the normal pathways, if there is a Th1 pathway, it produces interferon gamma, which will take care of the immunity. If this interferon gamma is delayed, it produces IL6, TNF alpha, and IL8. This ultimately will lead to cytokine storm. So if I want to prevent my cytokine storm, I need to activate at the level of gamma interferon, and I need to prevent something like NLRP, where IL-1 beta and IL-18, I need to stop. This is the pathway where I've talked about nuclear factor kappa B pathway for NLRP. And this is the pathway of arachidonic acid. And this is the pathway of macrophage to macrophage 2. And very clearly, TGF beta is responsible for healing of the lungs. So TGF beta, you can see the role of TGF beta and myeloperoxidases, MMPs. Now here, when the virus enters my body, it can cause NLR reaction within the cell, or it can produce a Th1 response or a Th17 response. And this is what you can see, the Th17 response, Th1 response. Now there is a thinking of shifting, that is the twist, shifting from Th1 to Th17 response. Without understanding the difference between Th1 and Th17, we cannot understand what is happening in the body. We are seeing a large number of mortality in Western world where they are not using Kada, they are not using Kalmek, they are not using Giloe, they are not using. The mortality has been low because they are only attacking on Th1. They are not attaching the Th17 pathway. Th pathway is evident by increased polymorphs and lower lymphocytes reaction, call them as NL ratio more than 3.18. Now, these are the cases which force me to think that we are missing Th17 pathway. This is a patient who got exacerbation of Th17 underlying disease. This is a patient of lymphadenopathy. Patient developed mental lymphadenopathy, eye conjunctivitis. You can see 3 patients, 1 episcleritis, 2 scleritis. Then we can precipitating. I have seen a patient precipitating with heart attack. We have Th17 pathway. We have Bell's palsy. We have cases with chicken pox. We have cases with shingles precipitated. These are all live cases. I'm just going one by one. These are the cases who got precipitated. These are the cases where underlying allergy got precipitated. This is psoriasis getting precipitated. These are all after vaccines. These are all after vaccines. This is rheumatoid arthritis, 4 cases getting precipitated. GI disorders getting precipitated. All these disorders have 2 cases of thyroiditis getting precipitated after the vaccine. Diabetes getting precipitated. Now, what is getting precipitated, what is common in this precipitation after the vaccine is Th17 response. And now this Th17 response answers all the difficult questions. All the unanswered questions can be cleared by this phenomenon. And that is treat both Th1 and Th17 response. Th1 is steroids. Th1 is colchicine. Th1 is mefenamic acid. That is a Th1 response. And Th2 response is artemisinin, high dose of vitamin D, and blood thinners, non-heparin blood thinners. Non-heparin, because in a Th17 response, your neutrophil recruitment increases MET and they cause platelet aggregation. So therefore, if you talk in terms of Ayurveda, pitta, vitiating pitta leading to kapha formation means response. Where when you say that my body is primarily a Th1 response, and now vitiated pitta has gone into kapha, and that kapha has started accumulating, that means the body has shifted from Th1 response to Th17 response. Th1 response will cause increased CRP. Th1 response will cause slightly rising in D dimer, but by the time Th17 gets stimulated, you start getting low platelet counts. Now, what is the current treatments available? You have antivirals, but antivirals, they causes blocking the NSP14, and unusual and uncontrolled use of antiviral can cause mutations. We have Th1 inflammation, mefenamic acid, colchicine, and steroids. So we have T17 platelet aggregation aspirin. We have T17 blood thinners, rivaroxaban and dabigatran. We have plasma, post-vaccine plasma and antibodies. We have immunity boosters, vitamin D, vitamin C, and vitamin E. And now we are talking about artemisinin and vitamin D as a Th17 inhibitor. So this is, therefore I say my topic is a twist, because the Western literature is not talking about Th17 at all. They are only talking about Th1. Remember, America is a Th1 society. Remember, Europe is a Th1 society. They have very high inflammatory disorder. Multi-system inflammatory disease is very common in America and in Europe. India is a is a society which is more of a mixed society, though therefore we are getting a pith kapha type of a disease. So when you have a pure pith, it is TH1. When you say pith kapha disorder, it becomes a TH1 to TH17 disorders. Remember, to identify TH17 pathway, the most important is day 5. On day 5, there is a shift from TH1 to TH17 precipitated by TGF beta and IL-6. Therefore, to reduce TGF beta and to reduce IL-17, IL-17 is reduced by vitamin D, and you reduce TGF beta by giving artemisinin. I'm not discussing the role of artemisinin because that is a subject for discussion. Now I'm only discussing the concept, how a modern medicine doctor understands the Ayurvedic physiology and correlates. And it very clearly says TGF-alpha, TGF-beta is responsible for neutrophilic recruitment, and it is also responsible for M1 to M2 macrophages and IL-12 production. Therefore, if you give TGF-beta, it will reduce number 1. With TH1, if you combine TH2 treatment, it will take care of primary inflammation, it will take care of thromboinflammation, and it will also prevent lung fibrosis. So my definition is TH1 is called immunoinflammation, TH17 is called thromboinflammation. In Ayurvedic language, TH1 is pitta vitiation and TH17 is pitta kapha vitiation. That's only I wanted to share. Thank you.
Thank you, Dr. Agarwal. This was phenomenal and an excellent way to combine Ayurveda with Western medicine. Not only you probably helped us understand the pathways of chronic meta-inflammation, what many bodies are carrying, and especially the role of TGF-beta in damaging lungs and how an anti-inflammatory diet and lifestyle coming from Ayurveda, balancing Pitta, would be actually helpful. So our next speaker, my dear friend and colleague, Dr. Pratap Chauhan, is a very reputed Ayurvedic physician, author, public speaker, TV personality, and a pioneer of Ayurvedic telemedicine. He started world's first Ayurvedic website, jiva.com, and is the only Ayurvedic doctor who have won the prestigious World Summit Award given by the United Nations Organization. He is the founder and director of Jiva Ayurveda, a company that runs a network of about 80 clinics all over India and world's largest Ayurvedic telemedicine platform, consulting over 8,000 patients daily. Dr. Chauhan has traveled all around the globe, spreading the knowledge of Ayurveda to common people. So let me welcome my dear friend and colleague, Dr. Pratap Chauhan. Pratapji.
Thank you, Suhasji, and thank you for having me on this platform. Namaskar, good morning to everybody, and good evening those of you who are joining from India. Good afternoon if you are joining from Europe. So my subject today is a little bit about mentioning like what's going on in India in the area of Ayurveda when we deal with COVID-19. So I will just quickly share my slide. So here is it. So I will be just briefly mentioning how Ayurveda is dealing with COVID management in India for last 1 year. Of course, from the very beginning when the pandemic was declared last year, Ayurveda has played a very important role both in prevention as well as later on in treating some of the cases which were like mild symptoms or asymptomatic or even some moderate cases. In fact, like I'm in touch with a lot of Ayurvedic physicians who are even working with some very serious cases also. Ayush guidelines, as you all aware, in the very beginning, Ayush issued some guidelines where they asked people to take the Ayush Kada, as Dr. Agarwalji also mentioned some of the herbs there, and various other things to do like oil pulling and putting some oil in the nose. So this was even our Honorable Prime Minister in his address to the nation. He specifically mentioned a 7-point program, and one of the points was he told people to follow the Ayush guidelines. Later on, when the it was a talk amongst the Ayurvedic physicians, like what can we offer in this pandemic. So Ayush Ministry actually constituted a research and development task force for COVID-19, which involved prominent Vaidyas from all over India, and there were also some scientists and modern medical doctors. This was a core group which looked into some various Ayurvedic herbs that could be used. First, the idea was to prevent the disease, and later on, when the disease was increasing, then also we stepped into treatment part also. And of course, quite a few research and clinical studies were initiated, which included somewhere like standalone and therapy, or somewhere even like add-on therapy or some prophylactic herbs. And just yesterday, I was having some talk with the task force group, and some very interesting results are coming out. They will be published very soon. Very, very interesting things have been seen in the clinical studies. And of course, later on, our health minister declared, I think it was around October, where he declared that Ayurveda can be included in the National Clinical Management Protocol for COVID-19. And there were specific guidelines like which herbs and which medicines. Of course, the Vaidyas could also personalize it according to their experience. Current situation, if we look at the current situation, and I would like to mention just 2 days ago, one of the prominent members of Niti Aayog, who is responsible for COVID response committee, he also declared that, now if you have COVID positive symptoms, you should visit an Ayurvedic doctor. And of course, he mentioned about immunity boosting also. Second wave, as Dr. Agarwal just mentioned, it's going really very crazy, and it's very scary. It looks like, it's going to touch maybe higher numbers soon of the virus. The vaccination is also in progress, but I think it's a long way to go before we can vaccinate the Indian population, because it's a large population. People are being advised to follow the safety guidelines and enhance the immunity. So I'll briefly just mention in my presentation today what is immunity according to Ayurveda, and what simple things we can do in our daily life, which we have been advising the people, a lot of people, and there have been quite a lot of survey done by Ayush Ministry and various other institutions, where they have found that almost like 80 to 85% people in India have been using some kind of Ayurvedic intervention. And I think that's one of the reasons we can say is maybe the mortality rate in India is quite low. Of course, there are other factors also. So I will just talk about immunity. We don't have the word immunity in Ayurveda. The word in Ayurveda is Vyadhi Kshamatva. It is made up of 2 words, Vyadhi and Kshamatva. Vyadhi means disease, and Kshamatva means to suppress or to overcome. So because the word immunity, when you think in modern terms, it's much different of what we think in Ayurveda. In Ayurveda, the Vyadhi Kshamatva is the strength that opposes the disease, its pathogenesis and progress. So this is how it has been described, and in Charak Samhita, they have described 2 divisions of Vyadhi Kshamatva. Number 1, this is the strength. Just note this point, the word is strength. This is the strength to resist the disease progress and to restrain the severity of the disease. This is the one function that the Vyadhi Kshamatva is doing. And second is, it is the strength within us that prevents manifestation and recurrence of disease. So this is how Charak describes about Vyadhi Kshamatva. But if you note here, the word strength is used. That means Vyadhi Kshamatva in Ayurveda, or if I call it immunity in Ayurveda, depends on a strength in our body. And this strength is, we have this strength from 3 different roots. This is the strength in Ayurveda is called, the word is Bala. So one is Sahaj Bala, which is natural or congenital strength that is inherited from parents, strength with which we are born. We can also call it the constitutional strength, the Prakriti. For example, the Kapha Prakriti, they are naturally more stronger than the Vata Prakriti people. And the second type of strength that we have in our system is called the Kalaj Bala. And Kalaj Bala is the strength which comes according to the time, according to the season. For example, winter season, naturally we have more strength as compared to summer, especially in India. The summers are very hot here. Also the age, youth is more stronger than the old age. Of course, the time of your birth, this goes into more into like astrological, and the place where you are born, all these things are impacting your Kalaj Bala. And then finally the third is the Yuktikrit Bala, which is the acquired strength, which we acquire through taking some rasayanas, rejuvenating herbs, of course eating wholesome diet and having a good lifestyle. These are three types of balas. These balas, they have 3 levels also. We need to understand it's not just eating some chawanprash or taking some ashwagandha. Very important, especially because when I'm dealing with COVID patients these days, a lot of people have low mental strength. Their manobala is very, very low, and they have a lot of fear, anxiety. So that is causing also a damage to our immunity, according to Ayurveda. And of course, we also talk in Ayurveda about the spiritual strength. So I will briefly mention strengths at different level. What should we do at physical level? I'll be just sharing with you some daily rituals that you can do. So at the physical level, there are 3 things we need to address. One is the Agni Bala. If your Agni means your metabolism, your digestive fire is strong, so then you can digest and metabolize the food you're eating, and that will get converted into strength. Ayurveda says that the food you are taking in gets ultimately converted into dhatus, which are the sustaining tissues. So this is called Dhatu Bala. Dhatu Bala is the quality of tissues that you have, and that is the basis of the strength. And finally, there is a Bala which is called the Oj Bala or Ojas. This is the essence of all the dhatus, and this we can call it a vital fluid which is responsible for immunity, positivity of mind, and intellect. So how do we increase these different types of strength in our body? So first of all, daily rituals for body. These are very, very popular now all over the world, and people have been using, very effective. Hygiene, of course, everybody understands hygiene is very important. Taking shower, it's not only about washing your hands. Taking shower, wearing clean clothes, and cleanliness around your surroundings wherever you are. Sanitization, fumigation is also mentioned in Ayurveda, burning some herbs to just kill the microbes in your surroundings. And Abhyanga, which is a full body massage. I have been talking about this concept of wearing a Ayurvedic PPE kit. So our PPE kit has many layers, and the first layer of that is the oil. So if you oil your body, including your nose, ears, head, everywhere, and of course putting oil in the nose. Anu oil has been doing wonders. The word Anu means atomic. It actually penetrates your nasal membranes and goes all the way down into the respiratory tract and protects your respiratory tract against the virus. Oil pulling is very popular now, putting some oil and swishing around. This also is very, very good to clear your oral cavity of all the microbes. Gargling with warm water, little salt, and steaming. Many hospitals in India, they have been telling us that all the staff, nurses, doctors, they do steaming twice a day. You can put some eucalyptus oil or fresh mint in the water, and this is also killing the virus right there in the nasal area and doesn't let it enter into the respiratory tract. So these are some simple things which you can practice and just protect yourself from the virus. Even if you are having some mild symptoms or asymptomatic, these things will be wonderful. For the Agni, very nice to have morning tea. You can have cinnamon tea, ginger tea, fennel tea, cumin tea, working on your Agni, enhancing the strength of your Agni. In Ayurveda, Agni plays a very important role in in fighting the disease manifestation and also in the treatment of disease. You can make a water, I call it the ginger cumin tea. Just 1 liter water, add a teaspoon of ginger, fresh ginger and cumin, boil it. You can keep drinking it all day. Keep it in a thermos. A fresh piece of ginger just before your meals, and a teaspoon of fennel after meals. These are very simple things, but very effective to just nourish your Agni. And if Agni is good, there will be no medium for the virus to breed. The medium, according to Ayurveda, where virus or any microbes, they breed in your system, the word is ama. And ama is produced from undigested food. But if your Agni is strong, there will be no ama formation. You can also chew a piece of clove and black pepper at least twice a day. Again, when the juice is going in, both black pepper and clove and even pipali is another herb, they have proven to have antiviral activities. So this is very easy. Everybody can do that anywhere in the world. There is some daily rituals for detox. So there is a detox water you can make. Again, this will work on ama. So you take 1 liter water, 1 teaspoon fennel, 1 teaspoon cumin, 1 teaspoon coriander, and some fresh ginger. Boil it very nicely. Keep it in a thermos, and all day you can keep sipping slowly. And of course, Langanam Param Aushadam. Very nice detox, very important, very effective. We have been practicing this with many patients, and this is called fasting. But when we say fasting, it's not just abstaining from food. You have to also do some fasting at mental level. Be silent, mona, verbal also, no talking, and also mind should be calm. And of course, these days we also call what we call digital detox. You have to stay away from the gadgets also. Exercise is also a way to detox. And in Ayurveda, we have a specific technique called the Svedana, sweating, in which we put even some herbs, and there is a special instrument for that. So these things can be done very easily for detoxing, so that there is no medium present to the microbes or the virus to grow in the body. And then we have some rituals for the ojas, because ojas, I also mentioned, is a part of our vital energy. You can have nuts and dry fruits. This is a wonderful formula. I always tell people, you can take 9 raisins, 7 almonds, 5 dates, 3 walnuts, and 1 cashew nuts, and soak them in water overnight. And in the morning, you can just eat them with some herbal tea, or if you drink milk, you can drink milk. Ghee is an amazing thing also to enhance our ojas. Honey is also very nice. You can make for breakfast some oatmeal cooked with raisins, dates, and coconut. Seed mix, very easily available these days. Pumpkin, sunflower, sesame, flax seeds, it's all antioxidants there. Golden milk has become very popular. Its turmeric latte is now very popular all over the world. So it's like milk with turmeric. So a quarter spoon or half spoon of turmeric in a cup of milk. Fresh fruits, seasonal fruits, vegetables, and salad. These are all ojas enhancing things which are easily available anywhere in the world. You don't have to really go anywhere. These things are available around you. So this is how you can increase the bala at the physical level. Now, something at the sensual level, because senses are the contact point, and this is also where things enter into our body. So there is a nose. We have, so for nose aromatherapy, you can use clove, basil, and cinnamon. They're doing amazing work. I have been using all these things for last 1 year with a lot of patients all over the world. For the eyes, very nice to have some green forest, watch something green, maybe walk on green grass. Moon gazing is very effective to strengthen your eyes also. For the ears, you can listen to some mantras, music therapy, or ragas, classical music. For skin, after oil bath, some light oil, fragrance, perfumes. And for the tongue, some herbal tea. So 5 senses are satisfied. They are kept clean also. You have to clean all the 5 senses and also oil them regularly, because they are the pathways which ultimately end up in some nerves. So we need to constantly keep them lubricated so that there is no aggravation of vata there. And then, of course, there are immunomodulating herbs which are now very popular all over the world. Chawanprash is one of them. Amalaki, Ashwagandha, Guduchi, Pippali, Yasti Madhu, which is licorice, Shatavari, Triphala, Shilajit, and Gokshura. These are commonly available anywhere in the world. Now they're very popular. So you can choose one or two of them and take them on daily basis. If you have any questions, you're always welcome to get in touch with some Ayurvedic expert to get more information on that. Now, some rituals for the mind that you can do. Mind, if you want to make your mind strong, in Ayurveda, the word is sattva. You have to enhance the sattva guna, which is easily done by eating sattvic food and having a sattvic lifestyle. So when we say sattvic food, in simple language, I can say the food that has prana in it, fresh, natural, organic, vegetarian food, fruits, vegetables, and lifestyle, again, following the dinacharya, ritucharya, all these basic principles in Ayurveda, and of course, following your prakriti, having a diet and lifestyle according to your prakriti. Sattvic music, because in Ayurveda, when we say food, it's not only what we eat from mouth. Anything that goes in, aharyate iti ahara. Whatever you hear, whatever you smell, whatever you see is also food. So make sure you're listening to some sattvic music, something more maybe spiritual chants. You read something sattvic, you watch something sattvic, and even think sattvic. Environment should be also sattvic, fresh air, sunlight, water, and associating with sattvic people, which is called satsanga. Sleep is very, very important for mind. We say sleep is the diet of the mind. So sleeping, having a good sleep, 6 to 8 hours of sleep time, and sleeping timing should be regulated. Go to bed early and wake up early. And finally, laughing is a very, very nice exercise. Find any reason to laugh whenever you can. And if you have no reason, you can even laugh artificially. You can laugh on yourself. This will increase the happy hormones in your body, and that will strengthen your mind, make your mind positive, which is a very, very important part of Vyadhi Kshamatva according to Ayurveda. And just finally, some rituals for the Atma, for the soul to develop the spiritual strength. Soul likes truthfulness, because when we are truthful, then we develop a spiritual power, spiritual strength, practicing non-violence. Charity is also something we should always think about, which means helping others, trying to do something good for the society, for the environment, for the people, practicing empathy and compassion. And of course, the food for soul is love, which you can practice among people, you can practice it with animals, you can practice it with the plants, with forest, with nature, and of course, you can connect with God, and you can also have a loving relation with God, which is called now, connecting with God is prayers to God or meditation. So all these things you can also practice, and this is how you can develop a good strength, which is called bala, at physical level, at mental level, and spiritual level. And this is what is going to impact your Vyadhi Kshamatva, or what is called immunity according to Ayurveda. We are still in a very difficult times. We have done wonderful work. I know a lot of people in India have been following these principles, but now as India, is facing the second challenge, I'm sure we will definitely come out victorious in this one also. And as this particular webinar is also going to be talking about like artemisinin and palmoheal, we're also working with Dr. Suhas and Dr. Saran and Hitesh, and we're trying to also make it a little bit more awareness, create awareness in the people, how they can work with this also amazing capsule that has been created for anti-inflammation, and a lot of work has been done, which you will be, I think, hearing from other speakers. Thank you very much. Namaste.
Thank you, Partap ji. And this was all music to my ears, and I heard Dr. Agarwal tell us and decode very eloquently about what the situation is and why people are facing this. And Partap ji gave a very simple, very practical, very applicable prescription, I would say. And as we all know, that this pandemic is, in Ayurveda, Partap ji would agree, is Janapadodbhansa Vyadhi. It's something which is happening at a pandemic level, and we need to bridge the humanity, because the hostile passion, the hostility, not only in India, but all around the globe, it kind of is giving rise to the global warming, and the inflammation that we see in the body is internal global warming. And we all need to bridge and create this rise of upswing of consciousness. And that's exactly what we are trying to do here. And who better to bring this message to all of us than my dear friend and mentor, Dr. Deepak Chopra. Dr. Deepak Chopra is the founder of the Chopra Foundation, of a non-profit entity for research and well-being and humanitarianism. Chopra Global, a modern-day healthcare company at the intersection of science and spirituality. He's a world-renowned pioneer of integrative medicine and personal transformation. Dr. Chopra is a clinical professor of family medicine and public health in the University of California, San Diego, and the author of over 90 books translated in over 50 different languages. More importantly, 70 of them have been New York Times bestseller. Time magazine has described Dr. Chopra as one of the top 100 heroes and icons of the century. The poet and the prophet, my dear friend, Dr. Deepak Chopra.
Dr. Deepak Chopra, and it is my great privilege and honor to associate with Ayurveda on a collaboration bringing Ayurvedic therapies for the prevention and treatment and even reversal of chronic illness. Chopra Foundation is creating a roadmap for the future of well-being and where Ayurveda fits in with all that we know today about genetics, epigenetics, inflammation, and both susceptibility to acute and chronic illness. Given that, as we've watched the pandemic over the last 1 year, the COVID-19 pandemic, there is now enough data to suggest that those who are at risk of morbidity and mortality from COVID-19 fall into two categories. The first is elderly people with chronic disease, but also not so elderly people who have some kind of risk factor like diabetes, metabolic syndrome, heart disease, high blood pressure, cancer, autoimmune illness. These people are at high risk for both morbidity and mortality from COVID-19. This is a given. Also, right now, it's very obvious that less than 5% of disease-related gene mutations are fully penetrant in that they guarantee the disease. But now with all that we're learning about epigenetic modulation, acetylation, demethylation, the on-off switches that we call the epigenome, we now have really good insight into how Ayurvedic therapies, including daily and seasonal routine, diet, pranayam, yoga, panchakarma, all these have real impact on mitigating and preventing and even reversing disease. We also know that those who are at risk have anxiety, depression, and low-grade inflammation for decades before they actually get the sickness. On the other hand, we are also seeing some young people now who are getting quite sick with COVID-19. And some of these people are getting sick because they are more susceptible to the variants, the mutations that are occurring in COVID-19. For this reason, it's very clear to me that Ayurveda is the most complete science in all aspects to prevent and cure and reverse many chronic illnesses and also prevent acute episodes, because the younger people who are having morbidity and mortality from COVID-19 are getting what are called inflammatory storms. And these inflammatory storms are related to what is called sympathetic overdrive. So everything we do in Ayurveda is to override the sympathetic overdrive through vagal stimulation, through anything that accelerates or activates what is now being called the renew, reset, digest response. So the sympathetic overdrive is countered by the renew, reset response, which is also called the reset response. Only Ayurveda has the complete technology for this kind of renewal. Given that, there's a whole body of knowledge in Ayurveda on what we call adaptogens. So when we look at Ayurvedic herbs and the whole pharmacopoeia of Ayurvedic herbs, and we look at these herbs, it doesn't matter, Shatavari, Ashwagandha, Triphala, all the others, including Amlaki, we find that they not only have anti-inflammatory properties, but they're also have what we should call properties that can be classified as adaptogens, in that these herbs help modulate the body's response, even at a cellular level, and help the body adapt to anything that causes inflammation, stress, or sympathetic overdrive. So in the last few years, the Chopra Foundation has also collaborated with other researchers and looking at the benefits of adaptogens. We can find them in the National Library of Medicine, but also if you do an academic search through the Chopra Foundation on adaptogens, you will find that we have done a lot of research in compiling the data on adaptogens. For this reason, I'm enthusiastic about Artemisia as a very potent adaptogen that may have a significant role in reducing morbidity and mortality and maybe preventing COVID-19. We need to see that, but all the evidence indicates that it could be a very potent adjunctive therapy in both prevention and treatment of COVID-19. Adjunctive, in addition to whatever else is effective. So science today is based on evidence, and it's not whether it's alternative science or integrative medicine or whole health medicine. It doesn't matter what the term is. If there is evidence, then that it works. That's all we care about. Okay, so with that, I just want to say that I'm looking forward to collaborative studies on Artemisia with Ayurveda, and looking forward to expanding the knowledge that comes from adaptogens in general, but particularly Artemisia right now because of the COVID-19 pandemic. So please look up our research and hope that we can be partners in this great effort to prevent chronic illness and possibly even acute illness. Thank you very much.
Thank you. That was a wonderful message from Dr. Chopra, and we're honored that he provided the video for us. Next, I'd like to introduce Dr. Suhas. Dr. Suhas, thank you so much for doing the moderating and for introducing our previous speakers. Now we get to hear from Dr. Suhas. Dr. Suhas is a classically trained Ayurvedic physician with over 30 years of clinical experience. He is the best-selling author, motivational speaker, and an acclaimed educator in the field of Ayurveda and integrative medicine. He has traveled around the globe popularizing Ayurveda, yoga, meditation, and natural medicine. Dr. Suhas has been featured in many popular podcasts, radio, and television shows. He is also an advisor to the Chopra Center and is the director of Ayurvedic Healing Incorporated. Welcome, Dr. Suhas.
Thank you again. As we have been talking about these wonderful things and what Deepak was talking about, adaptogen and the science-based or evidence-based understanding of Ayurvedic wisdom. And that's exactly what I would like to present here in a nutshell. My personal experience, I've been practicing Ayurveda for over 30 years. And what I've been using is this artemisinin extract using Ayurveda in US and Palmohil in India that is available with that trade name there. So I would like to just share a few of my experience with using this. Before we go there, we all know Ayurveda, yoga, and Vedic wisdom is the greatest gift of India to the rest of the world. It's the original lifestyle medicine and the original personalized medicine. That's what Ayurveda is. It's literally the science of life. And as we are exploring the potential of so many Ayurvedic herbs and spices from their ethnobiological perspective, we are becoming more and more convinced that these are really loaded with pockets of vital nutrients that can be really utilized, and we can use that in conventional medicine along with whatever pathways that we are choosing to use. The pandemic has literally bridged the humanity, and it's time now, it's high time now to create a cross-cultural exchange of knowledge. We ran a clinical trial on an Ayurvedic herb that was in use over a millennia to evaluate its safety and efficacy for COVID-19 as an adjunct therapy. Along with using this, Palmohil, which is a branded supplement product available in India, is an Ayurvedic inspired from Ayurvedic pharmacopoeia, but using the latest manufacturing standards, modern scientific processing and standardization technique. So when we are using this, it's exactly a very pure quality product that is available. And I would just like to decode some very, very basics. And Partap has given the highlights that when we use an herb or a medicine or a drug, we have to look at the lifestyle in general. And the government of India has given wonderful template about doing that. I don't want to go into great detail about what to do, but sipping hot water, having a good bowel movement, a good high fiber diet, keeping all the moving part moving, having brisk cardiovascular exercise, scraping your tongue, steam inhalation, putting drops in the nose, eating warm cooked meals, physical activity, practicing yoga and meditation, purposeful activities, sipping herbal teas, all of those is important. But I would just like to give you an understanding from my clinical perspective about how and when I have been using Palmohil in my practice. So the question that I often hear that, yes, you have created something that is used for COVID-19, but how and who should be using? So these are some very simple basics. If you are tested positive for COVID-19, you are a candidate for using Palmohil. If your RT-PCR test is positive, even if your symptoms are similar to COVID, but you're not tested positive, you can do this. The reason why I say that, it is adaptogenic. It is an adaptogenic herb which absolutely understands the internal state of the body and adapt itself to manage the imbalance itself, even if you have a flu-like symptoms. So we are creating or understanding a broad spectrum remedy for variety of different viral strains, and including the mutations as we are learning more about it. If you are exposed to someone who is tested positive for COVID, you should be taking Palmohil. You were tested positive and were treated in a hospital earlier, but you're trying to avoid any scarring of your lungs or any other vital organs. If you're tested positive with no symptoms, and there are millions of people like that who are tested positive with no symptoms, it doesn't mean that you will not have any damage because of that. You can still take it as a prophylaxis. If you're not vaccinated and are planning to travel short and long distance and fearful of exposing yourselves to many people that you're not familiar, you should take Palmohil. If your antibiotic test is positive, if your antibodies test is positive and have lingering symptoms afterwards, then also you should take Palmohil. If you want to prevent any kind of lung damage, fibrosis, pulmonary fibrosis from viral infections, I think this is useful. Because the classical Ayurvedic understanding of Artemisia absinthium, Damanaka, it is respiratory tonic, it protects the lung, it is a cardiotonic, protects the heart, and in spite of being exceedingly bitter and astringent, you can feel the bitter and astringent taste on the capsule when you put it in the mouth. And more importantly, in spite of light, dry, bitter, and astringent, it has a heating potency, so it is a very potent anti-inflammatory. And with a single dose, the unique quality about this delivery is you are just taking one capsule a day in the morning after breakfast for 5 days in a row. It's so simple, so easy, anybody can do it, to swallow a capsule, one capsule a day for 5 days. Try to take it at the same time every day. Do not miss a dosage. If the symptoms persist, take another capsule on the 6th day. Give a break for about 5 days in between if any of the symptoms linger thereafter. And this is all based on the clinical study that we did in India in hospital admitted patients using Ayurveda. And that's exactly what we saw, that how quickly people were recovering. When people were having symptoms, WHO scale 2, 4, or 6, and admitted in hospitals, because of that, their ability to reverse the symptoms on the 3rd day itself. And as Dr. Agarwal pointed out, on the 5th day, when the conversion happens, it is able to nip it in the bud before that. If any symptoms are present, then take it for another 5 days. The wise, commonsensical understanding, keeping the diet simple, nutritious, and easily digestible, hydrating with plenty of warm or room temperature water. You may take an anti-inflammatory if needed. You can continue with basic supplements like vitamin C, D, and zinc. You can repeat a COVID test after 3 weeks just to make sure that you are completely recovered and you are not able to transmit this to anyone else. You can use the AI app, the artificial intelligence app, which is on the back of Pulmoil, so that you can track your lung congestion. And as always check with your physician if needed. So this is my clinical experience. I have had hundreds of people who recovered on this very, very simple remedy. And I would encourage any of the health professionals who are here to give it a try and use it. I think Hitesh will tell us where you can buy it in India and how we can use it. So I'm going to stop it here and pass it on to Jennifer. Thank you. Namaste.
Thank you, Dr. Suhas. Thank you for all that wonderful information about Pulmoil and how to treat COVID or prevent COVID if you don't have it yet. So we'd like to introduce Professor Paul Mills next. He's a professor of family medicine and public health, the director of the Center of Excellence for Research and Training in Integrative Health, and co-director, Translational Research Technology, Clinical and Translational Research Institute at the University of California, San Diego. Professor Mills is currently serving as the Director of Research for the Chopra Foundation. He has expertise in integrative medicine, traditional medical systems, and psychoneuroimmune processes in wellness and disease, publishing numerous manuscripts and book chapters on these topics. Welcome, Professor Paul Mills.
Thank you very much, Jennifer. Great. Thank you very much, and hello, everyone. It's such an honor for me to be able to participate in these sessions with you all. As Jennifer said, I'm currently Director of Research for the Deepak Chopra Foundation and also a professor at the University of California at San Diego. I want to share with you briefly some of the research we've been doing as part of our collaboration with the Chopra Center and the University of California. This first study on meditation and vacation effects having an impact on disease-associated molecular phenotypes. Although the title says meditation effects, it was actually an intensive 7-day Panchakarma program, which was a randomized clinical trial at the Chopra Center a couple of years ago. The primary findings I want to share with you today, relevant to today's symposium, if we can call it that, is we found that those people who had been randomized into the intensive 7-day Panchakarma program had a radical change in their gene expression on their white blood cells, which are indicative of the genes changing expression throughout the body. And what we saw that was particularly striking, the genes changed so that they had an improvement in the regulation of their typical stress response, and also improvement in regulation of many genes relevant to immune function, indicating improvement and a strengthening of the immune system's capability for surveillance and also response. I also want to share, this isn't so much inflammatory related, but we also looked at just general effects of the intensive Panchakarma program on well-being across all these participants. And we found spontaneous changes and improvements in the participants' own sense of spirituality, their sense of gratitude, and their sense of self-compassion, and also reductions in just sense of depression and also anxiety. So overall, in addition to the biologic changes we're able to see, people in the Ayurvedic Panchakarma program also had just a generalized improvement in their sense of well-being. We also last year published this paper, Meditation and Yoga Practices, Treatment for SARS, and this essentially review article and its publication, over 26,000 downloads from the internet, showing how much intensive interest there really is for alternative approaches to help support our bodies and minds in the wake of this COVID phenomenon. This is a figure from the article where we reviewed at least what was known at the time of the effects of SARS-CoV-2 infection on different inflammatory biomarkers in the body. And what we're able to show is if we do an intensive dive through the meditation and yoga as well as the pranayama literature, that all these types of practices from traditional Ayurvedic programs serves to strengthen and in some ways we could say oppose those directions that the infection would normally impose upon a person. And we're currently in the midst of a follow-up review article as I'm speaking. I want to close with another area of work we've been doing as part of this collaboration directly relevant to inflammation. And this is in the area of cardiovascular disease. And this isn't an Ayurvedic study per se, it's more falls into the realm of integrative medicine and integrative health here in the United States. Integrative medicine, I'd say in many ways is wanting to emulate whole systems such as Ayurveda. It's not quite there yet, but we're moving along with some progress. And this is a particular study. We did look at cardiovascular disease and people with heart failure. And heart failure, as many of you might know, is characterized by intensive amounts of chronic inflammation, which, as was noted earlier, is really a pitta problem, a pitta disorder, we could say. And the intervention we chose to use for these particular heart failure patients was gratitude, which is a way to improve really the positive state of our mind and emotions. And we've published some of these papers in these articles as I'm showing you. What did we find? Well, what we did initially, actually, several studies, and one of them was a randomized controlled trial where we took some patients with heart failure and we randomized them to keep a gratitude journal for 8 weeks. And during those 8 weeks, we asked them to sit down and write out several things that they feel particularly grateful or thankful for in their lives. They were able to write a few sentences or they could write paragraphs, whatever they wanted. So some patients were randomized to journal, and the other sets of patients were randomized to just their usual care, which would have included their medications and exercise and dietary regimen. So what did we find from 8 weeks of gratitude journaling? Well, relevant to our sessions today and inflammation in COVID, I'm showing you this particular graph. And what we found is those patients who kept a gratitude journal for 8 weeks had an approximate 22% reduction in their systemic inflammation, as measured by a panel of 5 standard cardiac biomarkers, including TNF-alpha and IL-6, as well as a specific biomarker for the heart itself. So this is a very striking effect of just when we can change the status of our mind and emotions and how we're perceiving the world, our bodies respond quite quickly in a positive way. And on the right side of the graph here, you can see under usual care, those patients who did not have the journaling intervention, they continued with the same amount of inflammation they had been having prior to the study. I also want to note another effect of the journaling, which is also relevant to inflammation, was improvements in the heart rate variability of those patients who did the journaling. Heart rate variability is a measure of cardiac regulation, when we can improve our heart rate variability, that's an indication that we're improving the influence of the vagus nerve on the heart itself. The vagus nerve has a very big role in regulating emotion, as many of you know. So we found that those patients who did the journaling intervention had improvements in their HRV. And this is important because in cardiac diseases, particularly in heart failure, there's a general loss of heart rate variability as the disease progresses. So in this case, this integrative approach was very helpful in reversing some of the loss of heart rate variability. And this paralleled, as I showed you earlier, reductions in inflammation. And finally, my last slide, this is just also wanting to note that in addition, these patients had improvements in their just general sense of well-being, not only inflammation and HRV, but just improvements in their mood and overall sense of quality of life. So these are some of the projects we've been doing with the Chopra Foundation, and we're in the midst of ongoing projects, including our collaboration, as Dr. Suhas was just sharing with us earlier. Thank you.
Thank you, Professor Mills. That was very interesting and always a good reminder for the connection between mental state and the state of the body. So thank you. I'd now like to introduce Dr. Vong Tru. He serves as the CEO of Oncotelic Incorporation and is an expert in pharmaceutical development. He has been a leader in several prominent biotech companies and institutions, including president and CEO of Yggdrasil, CSO, and board director of Sorrento Therapeutics, board director of Sanomed, and director of cardiovascular biology at Parker Hughes Institute. Dr. Tru holds a PhD in microbiology. He is a member of ENDO, ASCO, AACR, and many other professional organizations. Dr. Tru is widely published and has over 100 patent applications and 39 issued US patents. Welcome, Dr. Tru.
Thank you, Jennifer. I'm going to share my slide deck.
Gentle reminder for everybody to be mindful of the time. We have some wonderful speakers in line. Thank you, Dr. Wong.
Yeah. Okay, so hopefully everyone can see the slide. Oh no. Okay, so today I'm just going to be talking about TGF-beta in COVID-19 based on the excellent presentation from Dr. Agwa. So the COVID-19, what it does is it induces TGF-beta productions. And when the virus infected the cells, it makes a lot of TGF-beta, which caused the cells to even produce more TGF virus. And then the TGF-beta also upregulate the furin, which is increasing the ACE receptor. So you enter the so-called vicious cycle, the positive loop. The more virus replicate, the more TGF-beta is made, would induce more virus replication. So that gives you this so-called TGF-beta surge that cause all the pathology of COVID-19. COVID-19 has a lot of symptoms, thrombosis, inflammation, vasculitis, pneumonia, and fibrosis, but they all can be fall under the umbrella of TGF-beta, and there's a lot of publication over the year to link all these symptoms of COVID-19 under TGF-beta. So it makes TGF-beta a good target to go after to prevent and cure COVID-19. In that sense, we ourselves developing a pharmaceutical grade antisense against TGF-beta, that ongoing clinical trial. But at the same time, we feel that we need to find something that can be deployed quickly. And we reach out to the Ayurvedic text literatures and found this artemisinin that actually has activity against TGF-beta. It has a broad activity also against other diseases because TGF-beta is playing a central role in multiple diseases. It's a broad spectrum molecule that act on multiple diseases, but most important in the viral infection and the fibrosis. You all probably know of artemisinin derivatives, which is artesunate and all these molecules that have been modified chemically to target malaria. Now we like artemisinin because it has the desired lung accumulation, and it's been shown to be effective against lung metastasis. And we started a clinical trial fairly quickly in India using artemisinin. And this is just a description of the trial. I'm just going to skip that and move quickly to the outcome of the top line data for 120 patients of the trial. What we have shown is that Palmahil has a very good safety profile. We didn't see anything that would cause stopping usage of the drug in the patients. The only adverse events are really mild rash or mild hypertension that's transient. Now, what we really impress is when patients get treated with Palmahil, they exhibit a quick drop from WHO level 4 where they require to be hospitalized to WHO level 3 within a few doses of Palmahil, in contrast to just standard of care alone. And inconsistent with what we see as the role of artemisinin in TGF-beta, it not only blocking the symptom, but it's also preventing the scarring of the lung and the tissues so that you preserve the health of the lung. We found that O2-SAT it fully recovered by day 28 with Palmahil plus standard of care, but standard of care alone did not do that. As you can see here, patients come in with, on screening, O2-SAT is very low. Progressively with treatment, O2-SAT recovered, but they recover by day 28 completely, even beyond that of the discharge date. So this is consistent with what we have proposed as a mechanism of action for TGF-beta on fibrosis and lung recovery. This consistent with the O2-SAT recovery, we also see the recovery of respiratory rate, but we did not see that with standard of care alone. So these data really give us the proof of concept that Palmahil will restore lung function due to viral infections. And to quickly walk through a couple of studies that resonate with our study, where another artemisinin that was combined with piveriquine also was able to suppress viral replication and decrease on hospital stay. That study was published in the International Journal of Antimicrobial Agents. And also recently, a phase 2 trial was completed on artemisinin C, where artemisinin was combined with curcumin and used as an oral spray, and it was demonstrated to be effective in preventing progression of the disease as well as other symptoms. So all in all, the clinical data seem to support that artemisinin, when used against COVID-19, not only reduce the symptom of COVID-19, but also preserve the health of the lung post-COVID-19. Thank you.
Thank you, Dr. Fong. True. That's very interesting and great knowledge about Palmahil and artemisinin. We'd like to invite Dr. Vishal Rao to speak next. He is the Chief of Head and Neck Surgical Oncology and Robotic Surgery at Healthcare Global Cancer Center in Bangalore. He is a member of the High Power Committee on Tobacco Control and an international advisor to the World Health Organization Tobacco-Free Initiatives. Dr. Vishal is the inventor of Alm Voice Prosthesis, a speaking device for throat cancer patients. He has received multiple awards for his work in medicine and tobacco control and has numerous national and international publications. Welcome, Dr. Rao.
You might want to unmute yourself, Dr. Rao.
Thank you, Jennifer, for this lovely introduction. I'm just going to be sharing my screen. I hope you all are able to see the screen.
Yes.
A very special thank you to Dr. Suhas and to Sarang here for this opportunity. I must tell you, I'm personally overwhelmed with this opportunity. It was such a special opportunity to listen to Dr. Chopra, and I've been reading his books. I've been reading these philosophies, and I was tempted to change some of my slides after I saw him because I thought I must make some kind of communications and sharing some philosophical insights from what I've learned from some of his books, of what I've read. And so I'll take this quick opportunity to share some of my perspectives from today. Um, Again, thank you for this wonderful opportunity. I'm representing HCG. We are a chain of cancer centers, but I'm also playing an important role today as a part of the expert committee on COVID task force with the state government of Karnataka. And this is a brief introduction about the work we do at our cancer center. We are associated with the Royal College of Surgeons, and I'm currently also the editor of Journal of Precision Oncology. I'm recollecting these wonderful words by Winston Churchill. When he spoke about the World War II, he said it's a riddle wrapped in a mystery within an enigma, but perhaps there is a key. And I'm sorry to add some of these philosophies. I was again tempted to when I saw Dr. Chopra speak, but I think this is so emphatic of what is happening with COVID. We really feel that the words that he used somewhere nearly 100 years back seems to be so relevant to these current times today. And today, I can see that the greatest organizations of the world have gone wrong in understanding this COVID pandemic. And sometime back I wrote an op-ed on this called World War C and putting the pandemic in perspective, which broadly talked about various philosophies and of our understandings from COVID. Now, when you look at India's graph today, we are currently around, I think, about 14 million cases and about 1,73,000 deaths, about 173,000 deaths. So there's a lot of learning from these curves, from what we've understood. And that's something that I wish to share through this particular few slides. You look at this, we are currently at the crest of the second wave, and we are realizing that the second wave seems to be a little more daunting on us than the first wave. And we had some presumptions when we started the first wave. We thought that between our states, we thought Karnataka in my place where I reside in Bangalore was different from Maharashtra, which was different from Delhi. But sooner or later, we realized that whether it's UK, USA, or whether it's India, we are all much similar compared to this virus, which is connecting all of us in some strange biological way. So now when you look at the active cases that we're jumping the second wave higher than the first wave. And that's a lot of concerns for us at this current pandemic. And the epidemiologists, virologists, physicians, pulmonologists, ICU experts, all coming together. When we talk to all of them, we realize that nobody has decoded this entire virus completely as of now. And what we all are understanding is that there may be a third wave, there may be a fourth wave, and all the precedents that we have right now is only 100 years back. Look at the deaths currently from India. We've had a significant amount of deaths, although our mortality has been very, very low. Just because of the sheer numbers that we are having in India, our mortality numbers seem to be much higher when you look at the absolute numbers, not just the mortality rates. And I'm just going to show you some of these figures to just kind of get some of my messages into the imagination. But this is the daily deaths we are currently looking at in India. And when you compare the death rate with that of the recovery rate, there is naturally a 98 point plus recovery rates, and there is a mortality of about 1.37, which is still a big number if you say the population-wise estimates that we are looking at currently in the country. Now, look at the strategies that we had evolved through this pandemic. And I'm sure this is globally the same. We had the early infection stage, the pulmonary phase, and the hyperinflammation stage. Now we have the good, the bad, the ugly. All three of them in which we were working in various areas. And I think to a great extent now, the early phase is something that we've decided that we can win at home. And I think India is moving towards a very aggressive phase where we are one hand globally. I think looking at a benchmark of vaccinating people in a very, very campaign manner. But the second phase and the third phase are the troublemakers. They are the ones that are actually going to cause you trouble. So when you look at the absolute numbers of COVID patients, it's these stage 2 and 3, these two groups of pulmonary and hyperinflammatory phases where there is an increased burden on the healthcare system. There are failures in the healthcare system. There is fatigue in the healthcare system. And that is where we are actually evolving our strategies. And what are the potential strategies we've had? We've had remdesivir, we've had chloroquine, hydrochloroquine, we've used convalescent plasma, we've been using steroids. So there's a whole lot of attempts that are being done, but yet we've not found the magic bullet in this. And if you look at India perspective per se, I think there's a lot of problems happening from the point of view of you encountering the disease to getting the infection and then expressing the overt disease. So from the point of inoculation to the point of the disease is the time where a lot of time is being lost, especially for those when we're seeing mortality. And that is something that I think the governments are working hard uh, uh, to actually bridge this particular effort so that we are able to achieve the goal. In this, there have been a lot of aspects which we have been working from the ICU teams personally to look at how can we address and reduce deaths. So to think of it, my friends, I think look at it, a few grams of this virus has brought this world to a standstill. I was actually looking at the weight of this virus. They say it's 0.85 attograms. And just look at it, a few grams of this virus has actually decided to stop the world completely. And that's why I thought that this is most aptly called the World War C. Now, this is a new age war. I'm again building some Chopra philosophies into this. I'm tempted to, but we've fought this new war with this, not soldiers but doctors. We fought this war not with weapons but soaps and sanitizers. We fought this war with social distancing, not close encounters. And the funniest part is we've not only lost a loss of sense of smell, we've also lost common sense. And I think that's the funny part of this pandemic. We've actually lost ourselves to misinformation also. So when I looked at all the global perspectives, I think there are only two bad options we've had. Some people have chosen to lose health. Some people have chosen to lose economy. But there's been no good option. I mean, at the end of it, this virus has given you a very, very difficult situation. And we've seen the psychological impact, the economic impact, and the behavioral impact of this virus, which I think has been far-fledged. It has been far-reaching on the implications of this. Now, in India, I feel specifically we were very good at trace, trend, and treat. The test and treat were something that we were building upon. But what we realized later on was what was implicitly important was teamwork and training. And I think that's when we started synergizing more of our focus into teamwork and training, because we realized we did not have centers of pandemic preparedness. This had taken us by a blind side. And that is where I think we realized the importance of drills. And even at government levels, we're playing some very key roles now to strengthen our work on teamwork, training, to ensure that we are able to improve these drills. And I'm just kind of going on the broad aspect of the treatments. I wrote this article called The Pandemic CEO on something called stratagem, and why we need to win this war without a strategy, where we cannot win this war by fighting with this virus. And one of the most important messages we learned out of this was that we need to win this war at home, not in the hospital. I kept emphasizing this to governments, to my colleagues, to say that we need to win this war at home. You cannot win this war in the hospital. There is going to be a failure of the system if we do this. And that's where, Suhas, your work and the work of Ayurveda and all has to be emphasized on, to understand how do we work on the immune system and not the virus. How do we combat this thing? And when I say home, we need to also address the home within our body, which actually needs to be understood and addressed here. The other second point, which I've been re-emphasizing, is that while through this pandemic, we need to be continuing to be productive and continue to collaborate. This is the time not to to compete, but to collaborate across the global scenarios. I said that we've lost more of common sense than loss of sense of smell. And that's been the sad part of this pandemic. I've learned a lot through reverse mentorship and conscious capitalism. But how do we bring value into this world? And I'm glad that the forum that you brought together through this entire effort, which Suhas and Saran and your entire team of the Chopra Foundation, Jennifer, all of you have brought about, is something commendable, and I much appreciate and thank you for the efforts you all have put in. I'm just going to close with some thoughtful remarks. What I wanted to tell you is, I think we all know about this story. People have spoken about it, but I'm going to jump into this aspect. Do the Indian strains differ from other strains? And there are some questions on this. We found that there are 33 different mutations among Indians, of which 18 were unique to India. Now, that's something that is very relevant to us. And among them, if you see, there has been a lot of talk on the double mutations that we found in several aspects of this country. And that's the one we believe is causing the worry today, the increased virulence, the increased infectivity, and as well as the aspect of its contribution to mortality. And I think in this, there are a lot of things that when you analyze are very relevant. I still remember the book, I think Mr. Deepak Chopra wrote on super genes, where he actually spoke about the microbiome, the importance of the microbiome. And today, I think we cannot emphasize this any lesser to say how Ayurveda is more of the natural aspect of dealing with the microbial load, which actually controls your genome. So if you have to tackle the viral genome, you need to have a good microbiome, which has to be somewhere in sync with the nature. And lot more amount of studies on epigenetics and others would need to be done, because we've known that even there is a high genetic diversity in the immune responses referred to by the HLA complex and others, even in the Indian scenario, and even the variation in the ACE2 receptors has been something of a key contributory factor. We've seen variations in the way the mRNAs are responding in the Indian groups to the higher percentages of natural killer cells, and vaccinations influence like BCG, mumps, measles and rubella vaccines that have actually played a role to train your innate immune system. So there's a whole lot of things that are at play to understand and explain why mortality is low, what could be playing the roles, what are the cues that we can learn from. Now, I'm pointing out to this because this was a global war that was going on among all the companies to fight on vaccines and to look at the race. And I'm asking a thought-provoking question to all the panelists here and to the participants. How many of this attention was paid on therapeutics? We only got running behind vaccine. There was not much of attention paid on therapy. Across the globe, therapeutics suffered, and I'm happy, so as you all are still striving in this and swimming in this race and actually leading the front. And I believe that a special appreciation to all from your team to have pulled these efforts off, because I think what you all have done is, against the tide of just the vaccine rush, we've forgotten therapeutics, we've forgotten therapies, and that is where I think you all need to push this much larger at a global level. I was looking at references to some very good, interesting Ayurvedic studies that came from India, structured, very systematic, and I think that's the kind of data we need. Now, this was the data that was published from the National Institute of Medical Sciences, Jaipur. I thought this was one of the very well structured studies that I went through, and it looked at a very systematic way of looking at the biomarkers, looking at the overall recovery rates, and this is the kind of data that the globe needs to understand Ayurveda. And I think I again congratulate your team. I've gone through your full presentation. I have some of the deep impressions of these in my mind from those slides that you all presented to me. What I wanted to make as a point to say is, I think science, you cannot call this alternate science, because science is just science. And I somewhere disagree with the thought also of saying an alternative science. There is no alternate science. There is one science. Our understanding of truths and facts differ, but there is only one science in this. So there is a need to collaborate across forums, which is what you all are doing. And I'm again very happy about that. I'm going to flip through this data, but I just want to close my presentation with 2-3 points. I think it's also going to be about leadership during the COVID times, and that's what we've been talking about leadership from behind. You cannot lead from front, but you may lead from behind. Like I know today in the medical front, none of us are an expert. But when we come together, we know at which juncture who can lead. If it's policy, I go in front. If it's ICU, somebody else goes in front. So it's the time when we collectively think about how are we going to play the leadership role like a wolf pack, where we know who can lead from front and who should stay behind at this time, you know. So, and again, want to bring this very interesting point. You know, when you look at data, from bench to bedside, it takes 17 years for you to bring something to the market. And you folks have actually pulled off something which I call as the hyperloop. You've actually created a hyperloop for research in COVID-19. So again, a special a shout out to all of you guys. It's humongous. I want to deeply appreciate this because sitting in this ecosystem, I understand how complex it is to navigate through this research from basic sciences, bench work to bringing it to practical research. You all have, I think you all are at the finish line, and I just want to encourage all of you people who are working so hard on something as impossible as this to tell you this is it. This is what you have to do. You know, and you know, I remember a very nice quote from Mr. Bose. Amar Bose, the inventor of the Bose the music system, he said something very beautiful. If you think something is impossible, don't disturb the people who are doing it. You know, let them do it. And I think you are the people who are actually trying this task today. At HCG, you know, when we started our work, we actually started some of our work on plasma therapy. We were the first in India to run these trials. We started a trial on cytokine therapy, which is currently at phase 2. We're working on mesenchymal stem cells. We set up our first plasma bank with our defense ministry. We started something with chest X-rays to detect COVID. So there's a whole lot of work which we continue to do through this pandemic, actually just to make our little dent. I don't know how significant we were, but I'm happy when I look back. Last year, I said I was productive. I made my bit to contribute to the society. Whether I succeed or not is a second question. So I think I'll close with these remarks. I just wanted to close with this one photo of this lady. You know, this lady is a sweeper. She's a janitor in my hospital. At 11 p.m. at night, during the peak of pandemic, I was actually walking down through my tower at about 11 p.m. when actually I saw her sweeping the floor, and I was quite amazed at her. And I was cribbing about my life. I was cribbing about how terrible life was, how you know, life was just not just to every one of us. And I was just unhappy about being late and being isolated when I saw her smiling and sweeping the floor. And I looked at her and I asked her, "Tell me what's your name?" And she said, "I'm Vasantamma." And I asked her, I said, "So this is the most neglected part of my hospital. It's the part of the library. And imagine the library is empty at midnight. You know, and this lady was sweeping the floor. There was no CCTV cameras there. This lady was just working." So I asked her, I said, "What is it that makes it special for you to work at this hour?" She said, "I'm just doing my job." I think that was phenomenal. I wrote a nice article on her. I just wrote a nice article on her because that day I sat in my car as I started to drive home. I was actually recharged. You know, I just thought of Vasantama and I said, this lady was just doing a job. I mean, she for me was like a doctor who was sweeping the floor of the hospital to keep somebody healthy. So you don't need to be a great doctor to actually be, you know, get the title of doctor. You can be Dr. Vasantama, the lady who just sweep the floor to inspire people and keep that area clean on COVID. And I think that's the role each one of us in the audience can play today to make our part. And I just want to close with that remark. Thank you very much again, Jennifer, Suhas. Thank you so much.
Thank you so much, Dr. Rao. That was such an engaging and informative presentation. And you really brought home the message of uniting Ayurvedic and allopathic medicine to treat this World War C that you mentioned. So next speaking is Mr. Saran Sand. He serves as CBO and General Manager of AI Division, Matillion Therapeutics. As a Silicon Valley entrepreneur, Saran Sand has been founder, CEO, and GM at startups and public companies and held senior leadership roles at companies. Sorry about that. At companies that were acquired by leaders such as Marvel and Qualcomm. Welcome, Mr. Sand.
Thank you, Jennifer. Thank you, everybody. It's an honor to be here with all of you. I wanted to share my slides. Is that okay, Jennifer?
Sure. You want to share your own slides?
Can you see them?
Yes, we do.
Yes,
Okay.
we can see them.
All right. So what is the role of therapeutics, as Dr. Rao eloquently outlined for us in the world of vaccines? So the collective industry did a great job, in my view, for fast tracking the vaccines. There's several of them available. But because of the vaccine escapees and the mutations that are also rapidly proliferating, the vaccines are no silver bullet, which makes the requirement for having booster shots from vaccines even more prolific along the populations throughout the year. So worldwide, right? So the logistics of the vaccines themselves, of putting a lid on this virus, is especially challenging. So what the world needs is research and therapeutics for treatment, for antivirals, for post-recovery, for indications that are related to respiratory inflammations and overall body inflammation. So the traditional classical drug discovery model is broken. It takes too long and is too expensive to solve the problems. So when we turn to ethnobotanicals, and specifically Ayurveda, we realized that these plants like Artemisia have been around for thousands of years, and they've developed a broad defense mechanism for all kinds of viral activities and loads. So because of our expertise in TGF-beta, we were delighted to discover in vitro the potent activity of this plant in the lab. And after completing the study, we are very encouraged and have launched the product PulmoHeal, which is available in Amazon, India, in Flipkart, in 1mg, and through medical associations, which will be deploying the product to make an impact on this pandemic. One of the elements of doing a clinical study, even though ours was very fast, it took us about 5 months to recruit and dose 120 patients in 3 hospitals in India, and to get the statistically significant data study back to us over a period of 4 to 5 months, which is a long time because of the speed of this pandemic. So what we have developed is, in addition to the drug, is a telemedicine platform that will enable patients and physicians to take the control back into their hands. As the drug is being deployed, there's a crowdsourcing mobile app, which will enable the patients to answer survey questions and to also provide their respiratory health by coughing into the mobile app, to be able to combine the drug with this mobile app as a personalized 360 solution, to be able to get information back to the physicians and back to the other patients in a rapid response, accelerated, fast-track manner, which overcomes some of the deficiencies with the classical clinical study methodology. So this is what we just discussed. We are deploying a 360 platform, which is a drug and a device. So patients who buy this PulmoHeal product will see a QR code on the product, and which will enable them to access the telemedicine platform online, where they can monitor the progression of the disease. So every day they take 1 capsule and they cough into this mobile app, which is using AI to score the severity of the disease. For example, a wet cough, a dry cough, the number of coughs, whether it's obstructive, restrictive, or normal. And this AI can then give them a score instantaneously so that they can see if they're getting better or worse. In addition, they get a chance to answer questions, which is a way of crowdsourcing post-marketing data, which is shared amongst all the patients and their physicians to fast track the indications, including post-recovery fibrosis, which is a major problem for recovering patients, as well as new indications, pneumonia and flu. So as we've already discussed, the data coming back from a study is phenomenal. The treatment arm with Palmo-Hill showed 5 days to asymptomatic versus 14 in the standard of care, which is a whole host of cocktail of allopathic drugs, including remdesivir, hydrochloroquine, and ivermectin. So we are very encouraged in deploying this platform. Along with the drug, we are working with IBM on doing this cough assessment, where the patients, the users, can cough into the mobile app to form a 360, going back to the Ayurvedic principles of personalized treatment at home. The physicians can monitor their entire patients through a dashboard to see how they are using this mobile app and how they're faring. And they can dive into the individual patient's symptoms and the survey that they're following remotely from their offices. And the crowdsourced post-marketing survey platform is designed to deploy this phase 4 drug and to be able to collect data, which is rapid, accelerated, and irrefutable for us to find new ways to deal with this fast-moving pandemic. We are very pleased to be working with key opinion leaders, Dr. Deepak Chopra, Dr. K.K. Agarwal, Dr. Pratap Chauhan, and Dr. Suhas Shirsagar. And together in this collaboration, we want to be able to make an impact on this pandemic very, very quickly. I have a short demonstration of the mobile app, but in the interest of time, let me just pass the baton to Mr. Sunil Duggal so he can talk about his experience before we can take some questions and answers. So thank you very much.
Thank you so much, Saran, for letting us know about this promising new treatment. The next speaker is Dr. Amambota, Shekhar Amambota. He has an MD in Ayurveda, and since 2002, Dr. Shekhar has been the founding director of OHAS LLC, Ayurveda Wellness Center in Pennsylvania, USA. He is the founder, president, and chairman of the Board of Association of Ayurvedic Professionals of North America. Dr. Shekhar is the director of Global Ayurveda Conferences, LLC, offering various international and national conferences around the globe. And he established Global Ayurveda Academy. Welcome, Dr. Shekhar.
I actually don't see him right now. Is I think getting some challenges with signing on right now. So why don't we move on to Mr. Sunil Duggal? And Sunil Duggal, as Saran was saying, served as the CEO of one of the biggest Ayurvedic company in India, Dabur India Limited, from 2002 to 2019, significantly growing and globalizing the company during his tenure. He was honored with the Distinguished Alumnus Award by Indian Institute of Management, Calcutta in 2019 for his achievements in the business and social areas. So he has his pulse on the finger of the current state of Ayurveda in India. So Mr. Sunil Duggalji.
Thank you, Suhas. I think I'm the only person here who's neither a scientist nor a practitioner, but a business person. So I'll be addressing the forum very briefly, of course, from a very different perspective. As head of Dabur, we also marketed Chyawanprash, which I was gratified to learn from some of the earlier speakers, is really top of the ranks in terms of its properties, in terms of immunity building. And it was a flagship product, so I'm delighted to hear that. But just to rewind back into the origins of COVID-19 in India, I'll be talking about COVID in the Indian context entirely. The disease began its journey a little over a year ago in March 2020, and it began in a pretty small fashion, ramping up from somewhere in March through overseas contact. The government imposed a very harsh lockdown, shut down the whole country for 3 months in an attempt to stop the disease and to build medical infrastructure. It did not at all succeed in stopping the disease, even though it did have a beneficial effect in building healthcare infrastructure. And the cases continued to rise till September, when they touched around 100,000. And then equally dramatically, they began to drop. And nobody really knows why, but I think one can connect the dots and saying that it was a single strain and there was some level of herd immunity being built up. And then the caseload began to drop. The problem with the caseload dropping is that everybody thought that the problem is over. So COVID inappropriate behavior, lack of masks or social distancing, etc., began to become endemic. And around January, we sort of troughed at around 10,000 cases, and things were looking pretty good. But then something different started to happen. The caseload began to increase, and increase very, very gradually, so as not to make us out of our complacency. It's a very tricky bug, as we all know. And then let's put it this way, it began to climb exponentially. To give you one data point, on March the 1st of this year, we had 12,000 cases. Today, 45 days after that particular date, we had 200,000 cases. Where will it end? Nobody knows. So I think it's very hazardous to predict where this disease will really go forward. Some estimates talk about 300,000, some say 500,000, one doesn't know. We are in uncharted territory. And why has that happened? Why has the caseload, which in the first instance peaked at 100,000, dropped to 10,000, is now once again getting into completely different waters? The answer has been provided by many of the speakers, is that the mutations and the different strains have meant that the herd immunity, which was perhaps built earlier for a particular strain, is no longer relevant. And also the vaccines, which were designed and crafted for a particular strain, may not be valid for the next. The vaccination program, which is the government is doing everything to push it forward, is also off to a slow start, simply because of the sheer volume. India has 1.4 billion people, and with 2 jabs, it means 2.5 billion doses of vaccine which are required. The production capacities are today at 60 million a month, maybe be ramped up to 100 million. So it'll take years for the population to get vaccinated. And then keep in mind that 1 year from now, when the virus loses its potency, when the vaccine loses its potency, we will need to get another shot of the whole thing. So the whole cycle becomes a very vicious one, in a situation where complete vaccination is almost an impossibility. So what do we do as a nation, as a society, so that to prevent a complete collapse of our economy and of our society? The situation is grim beyond belief. We have to look at alternative remedies, and we have to look at broad spectrum solutions outside the traditional vaccine. And that is where the discussion of today becomes so critically important. Alternative therapies, such as those promoted by Ayurveda, which can be easily dosed and be accessible and available to this 1 billion plus population strata, are really a solution which perhaps will complement vaccines, if not replace it, but will be an integral part of our solution. And if we don't pursue this, I think we'll be making a very, very big mistake on just relying upon the vaccine solution, because we'll never get there. I hope Ayurveda and anybody else who's pursuing this particular line of treatment the very best. I hope they're able to get over the regulatory bottlenecks. I know the challenges are immense, and Saran has been discussing some of them over the last few months with me. But I think the realization will dawn upon the regulators, upon the government authorities, upon the healthcare people in India, that we need to think outside the box. We need alternative solutions, and the traditional solutions are simply not working. So I wish you folks all the best. You people are doing an incredibly important job, and I think your success is important to all of us. Thank you.
Thank you, Mr. Duggal. And I know it's pretty late in India, and I think it's time close to everybody's bedtime. We have some questions, and I'm going to quickly take a look at it. And Jennifer, if there's something important for either one of the speakers, we can take a question each, if you think.
Yes, I've been going through the questions. I think the first one we can ask is directed towards Pomo Heal. So perhaps you, Dr. Suhas, or Mr. Saran. Can someone who has received one dose of the vaccine take Pomo Heal in case they develop COVID-19 infection or show symptoms of the infection?
The simple answer is yes. Even if you have a single dose of vaccine and you're showing some signs, you're safe to take Pomo Heal. That's not an issue at all.
Great. And for you, Dr. Suhas, again, can Pomo Heal be used? Is it used as a common remedy, or is it used as personalized medicine?
It's used specifically for this condition itself. We are not using it as a general medicine that can be taken for an extended amount of time for various lung condition and respiratory diseases. We're specifically using it for COVID-19 as of now.
Thank you. And for this is for Dr. Agarwal. How can we more understand the correlation of Th1 and Th17 with Vita, Pitta, and Pitta Kapha? Is there any research or more understanding literature on it?
There is no understanding, it's a logic. I am a student of Vedic medicine. I read a lot of Vedic medicine. And this is how you can correlate with them. And this also comes into the teachings of Deepak Chopra, who has been doing for the last many years. And if you read the whole thing, I can tell you that how did I started getting interest in Ayurveda as well as COVID is concerned. And when we started getting patients with happy hypoxia. When we started getting patients with happy hypoxia, I recalled the definition of brain death, where we say that Prana Vayu and Udan Vayu is gone, and the other three Vayus are present. Then I started reading Chandogya Upanishad and Prashanna Upanishad. And Prashanna Upanishad says that at the time of death, Pran Vayu merges with Udan Vayu. That means, so I started correlating Pran Vayu means oxygen or my respiration. Udan Vayu is my awareness. And then we start reading about Chandogya Upanishad, who talks about that the time of death, Vak Vritti merges with Mano Vritti, merges with Pran Vritti, merges with Tej, Tej merges with Sat. That's how they define. So therefore, I started correlating that, yes, there is that Udan Vayu in my body is awareness. And in this COVID-19, there is a differentiation that Pran Vayu is going, but Udan Vayu is not going. You are aware, but your oxygenation is less. And then I started initially when the Ayurvedic doctors were consulting, they were saying this is a Kapha disorder. This is not a Pitta disorder. If it was a Kapha disorder, so I started correlating all the symptoms of a Pitta disorder with modern medicine, and I started finding there is a mathematical correlation. Unfortunately, I haven't published it. I don't have a time, but if someone of you is interested, and we can jointly publish the whole findings I have. So this Pitta disorder has 5 different types of Pitta, 5 different types of Kapha, and 5 different types of Vata. Gives it a mathematical order why people are developing these disorders. Today, every symptom can be explained in modern Ayurvedic. I call them as Elo Veda. Elo means modern and Veda means Vedic medicine. If you combine that two things together, it can explain. So it can explain why joints are not getting swollen, why pericardial effusion is only occurring late in the life. So all these things, Ayurveda can explain lots of unanswered questions in modern medicine. That's how I correlate. But published data, we have to publish it in a modern, and pandemic is for the first time. The data is available, publishing has to be done by us and not by anybody else.
Thank you, Dr. Agarwal, because Ayurveda is an energy medicine, and understanding the energetics that happens within the physiology and correlate them with these very sensitive markers. And
I call them as a disorder of the Agni. And then I say all types of Pitta Agni and Dhatu Agni. So I normally say that if your Agni is slightly on the higher side, it is vitiated. If it is vitiated, and in that vitiated Agni basically means that it is like virus comes and puts a fire on the already high Agni. So this is basically a disorder of Agni and nothing more than that. So if your baseline Agni is abnormal, this viral will cause more symptoms than anything else. So therefore the role of Trikutu also comes here. Well, this is what Dr. Pratap was talking about, taking care of the Agni and digesting everything. So Trikutu also comes here in digesting it. So I have done a lot of work on a combination of Trikutu along with Kalmeg. Kalmeg is also a bitter, and if you see, Artemisia is also a bitter and astringent. Kalmeg is another bitter and astringent, and I have seen a very good response when we get a Trikutu along with Kalmeg. So I created a formula of K. I said K means KK, that's my name. And I said K for Corona, K for COVID. And if you remember the formula of K, K for Kadwa, which is bitter, K for Kasala, which is astringent, and Kadwa, K for Karela, K for Kalbe, K for Kalonji. And when you go to astringent, K for Ketfal, that is a elephant apple. And then in modern medicine, we have K for colchicine. So that's how I started working on the formula to remember everything, that anything which is Kadwa and Kasala will have an anti-inflammatory action. And now you have a Artemisia, which is also a very bitter and a very astringent. Anything which is a bitter and astringent has to be anti-inflammatory. That's a logic. I don't have to prove it. I don't have to give it because sweet is building, and pungent, sour, and salt are digesting. And you need to balance the sweet. You need a bitter and astringent. So this bitter and astringent, which is drying, is going to be anti-pitta, anti-inflammatory, and anti-cytokine activity.
thank you.
But I don't have any literature to talk about it because nobody is working on combining the modern medicine with Ayurvedic physiology.
And I think that's exactly what Chopra Foundation is doing
Yes.
to
That's what I learned it from there only.
bring in these different languages together and create publications, which is talking and probably providing evidence of how it is more relevant. Let me ask Dr. Pratap, there was a question here. Are there specific body types that you have seen, either Vata, Pitta, or Kapha type, that are more prone for COVID? You talked about general immunity and Vyadhikshamatva and Bala, and that is common in all the body types. But what is your clinical experience?
So I would definitely agree with Dr. Agarwal. I've seen it more active in Pitta constitution. And definitely, that's where I've seen more patients who get really worse who are already having a Pitta aggravation, Pitta vitiation, or their Pitta prakriti. And definitely the second one is Kapha, which we see. So it's more in Pitta and Kapha.
Thank you, Pratapji. And there's an interesting question here for Dr. Vishal Rao. Vishalji, they're saying that the doctors and the healthcare professionals are feeling the brunt of it, and how they can take good care of themselves and stay in this positive mentality, exactly the way you explained us.
Because I think this is a very, very difficult time for us. Like I said, the only way we remain positive is by looking at inspiration around us. and that's what I've been doing for the last 1 year. I had to not only continue to be inspired, but I had to inspire my team around me to ensure that we are all remaining productive. And this has been a very testing phase for us. It has not been easy. So I think the example that I gave of Vasantamma, the janitor, the cleaner, was one such example to tell how I was looking at inspiration in every corner at that point in time. I think the biggest thing that I would like to tell as a clarion call to all our health workers is, like a soldier is incomplete unless he goes for war. He cannot say at the time of war that, look, I was not ready for this. That is what is the call today for a doctor. And this is the call that we need to show. I must tell you one instance that one of my colleague doctors, one of the initial days of the pandemic, one day when I went to visit his hospital, was carrying a dead body and going. Because at that time in the COVID ward, there was no staff ready to touch the dead body. So he carried it and went. And while he was carrying it, he was actually getting help from another person to shift that body into the car, when a relative from far threw a garland at the patient. It was difficult. I mean, we have seen sites like this, but if you ask that doctor today, he was an inspiring doctor. He smiled and said, I played my part. That is what we all would need to do today. We understand the way the pandemic has played on us, and the only way is to continue to look at inspiration all around us and continue to inspire others, because someday people are going to look back and talk about our stories and say that these were the people who played their part. And that is very important for us. There is going to be no road map, no signboard, like like Dr. KK Agarwal sir said. He's one such inspiration for us. We keep listening to his talks and we keep listening to his lectures and his emails. We need to keep this road open to inspire others. I have no other answers to this. My only thing is that at this juncture, we need to play this part of ours, continue to inspire others by just remaining to be negative. And that's what I keep telling people. 1.5 years, I'm continuing to be negative because I'm playing my part constantly. And that is the precaution you will need to take also, and inspire others to say, look, if as a healthcare worker, I need to do this, you need to play that part. Today, I was telling it to one of our ministers that every economic center, whether it's a shop or an industry, needs to run like an OPD, needs to run like a clinic. That is the level of precaution you need to take.
Perfect. I fully agree. And thank you, Vishalji. And you're validating exactly the same point that what Paul was saying, that a grateful heart is a healthy and happy heart. So anybody who is expressing gratitude, like the way you did for Vasanthamma, is actually keeping you free of inflammation. And as you said, that we have to stay COVID negative and still be very positive to lead our life and do our job. So Paul, any comments about microbiome, what Vishal was saying, because it's such an overlooked area in this whole battle of COVID, that what's going on in the gut, because we all know about 96, 97% of the genetics we have is the microbial genetics. It's not even ours that is responding. So it's them that are responding to all this. So how can we populate that? How can we regulate that?
Yeah, indeed, Dr. Suhas, thank you for that. And thanks for bringing further attention to this topic of gratitude, which the research we've shared and other work of ours, it's such a powerful state of being, a state of consciousness to embrace as a human being. As far as the gut, I didn't share this data, but the Chopra Foundation has also been supporting other research at UC San Diego, specifically on the health of the gut microbiome. This is Dr. Christine Peterson doing this work, and she's shown repeatedly, both with in vitro work as well as randomized trials, that many of the traditional Ayurvedic herbs, she's looked at triphala, she's looked at licorice, and some others, have a profoundly positive effect on the gut microbiome, specifically moving it from potential states or states of dysbiosis to what we would generally consider a healthier gut system that presumably would have more Agni working as it should be. So it's very exciting work. Any of you who are interested, we post all of our publications routinely on the Chopra Foundation website. So if you just do a search, Chopra Foundation, look at the research tab, it's all there.
Thank you.
I just want one thing which always interests me is definition of Agni in Ayurveda. We say there are, he says 5 are related to the basic elements. And then we say there are 7 Dhatu Agni. And then they say there is something like Jathar Agni. Now, if you read Bhagavad Gita, chapter 10, it talks about that I am Jathar Agni. Then what is the Jathar Agni in modern medicine? If it is GI, then we have a GI Dhatu Agni. We also have a GI, basic element, Vat Pitta Kapha Agni. Then what is the Jathar Agni? Well, how can we define Jathar Agni? And I am convinced in my mind, Jathar Agni is the sum total Agni of the 5 basic elements and the 7 dhatus vis-a-vis the microbiome Agni. So the sum total Agni, a balance of my Agni and the microbiome present in my body, and that interaction Agni is the Jathar Agni. Otherwise, you can't explain it in modern medicine.
Absolutely. The junction point of the enteric and the central nervous system together. So as we have received many questions, we'll be posting answers on the website, on the internet, on the chat box for many of these questions and concerns, and we'll be addressing an FAQ column. As we conclude this wonderful webinar today, I would like to invite Mr. Saran to do a demo of this app. If you can show us a quick video of this, how the AI is working for assessing the cough, which is embedded on the packet of PulmoHeal.
Thank you, Dr. Suhas. So just ending with this quick demo and wishing everybody a wonderful evening.
Saran, we can't hear you.
No, he is not yet speaking.
Oh, you can't hear us? 1 second. I think, let me do this again. Okay, let me start this again.
On the progress dash, concerned about their lung health from COVID-19 or lifestyle like
Can you hear this?
Yes.
Yes.
smoking and air pollution. I will now walk you through registering and using this service. To proceed, you must enter your phone number to receive a one-time code. You will receive a text message with a one-time code, which you'll enter to continue to the assessment. Click the Submit Confirmation Code to proceed. On the progress dashboard, you'll see that you have 3 quick assessments available. If you would like to complete the full assessment and monitor your health over time, you will need to enter the 4-character code from the PulmoHeal box you purchase. For now, I will demonstrate the quick assessment. The first step is the survey, which has questions about your symptoms. You will want to check the symptoms you are feeling accurately, because this information will be used to provide the assessment. Then continue to the next step, which is the recording section. On this page, you'll record your cough, either spontaneously if you feel the need to cough, or you can force a cough. You will need to allow access to your microphone for this session only. The cough recording is being uploaded. If the recording is unclear, you will be asked to make another recording. You can also choose to delete the recording if there is unintentional background noise. After completing the recording, you will be given your assessment, which includes cough pattern, risk, severity, dry and wet cough counts, and cough severity score. Below the results, you will find a key to help you understand the assessment, as well as the benefits of using PulmoHeal.
Perfect.
So thank you very much. That's a full description bringing ancient Ayurveda, modern biotech, and advanced artificial intelligence into one box. So thank you for your attention And thank you, Dr. Suhas, for facilitating.
Thank you, everyone. Namaste. Have a good evening. Have a good day.
Namaste, namaste, everybody.
Namaste
Thank you.
and good night.